Then if you have any doubt or anything, you can basically write your question in the chat box, so I can read your question, I can give you the answer, or you can unmute yourself directly, you can interact with me. Okay. My screen is visible.
Yes, sir, visible.
So hi everyone, this is Dr. Akram here from Sydney, Australia. So today I'm going to present you to the migration for Australia. So what are the ways you can come to Australia and step-by-step process. So if you have any questions, you can ask at the end of this webinar. I will give you the time at least. We are here. I'm here for 2 hours. Okay. So just when you want to ask me a question, then you can just unmute yourself. Okay. So Academically is an Australian company, and we are a tech from Sydney. So we provide assistance for all healthcare professionals like medical doctor, dentist, pharmacist, lab technician, physiotherapist, optometrist, veterinary doctor. So any healthcare practitioner want to register themselves in Australia, so they need to complete some general steps. For example, document verification, the part 1. Then part 2, you need to write this exam. For example, in case of MBBS doctor, it's AMC exam you need to write. And then once you pass this exam, then you need to write this English test like IELTS, OET, or PTE. And then again, you have to go for the part 2. So these are the simple process for to migrate to Australia. So my name is Dr. Akram Ahmad. So I'm basically a pharmacist by training. So my bachelor's, master's, and PhD and in medicine from University of Sydney in Australia. I have around 10 years of teaching experience to teach this clinical pharmacology subject in India, Malaysia, and Australia. There are some of the faculties for this course. So there are 2 more faculty for this AMC. So Dr. Siplan Sharma she's basically MBBS MD from India, and she worked around 3 years in India after her PG. Then she write this AMC exam and complete the pathway. Currently, she is working here, one of the here in Blacktown. Okay. Another Dr. Rodara, she's from Sri Lanka. She also completed her journey, this AMC pathway. Now she's practicing here in Sydney. So all our faculty basically are qualified this AMC and they are involving in this, teaching for this course. So the opportunities in Australia, why you need to migrate Australia? You might be thinking about the UK PLAB or USMLE for US. So there is some basically advantage I can say. So at Academically, we provide coaching for USMLE. We also provide coaching for PLAB. We also provide for this AMC. Okay, but this webinar is connecting for AMC. I will try to little bit compare also with PLAB or USMLE wherever need. Okay, even so, if you have any questions also regarding the PLAB or USMLE, still you can ask or comment. So Australia, the only country they provide the PR visa, permanent visa after this exam. So if you complete this process, you are eligible to apply PR visa immediately. In UK, you cannot. In UK, first you need to pass part 1, part 2 and get a job, and you have to work there 3 years. Then only you can apply that PR visa, and then after 3 years you leave them, you have to get like citizenship. So it might take around 8 years to settle down in UK. But in Australia, if you pass this exam, immediately you are eligible to apply PR visa. So the 190,000 PR visa every year Australia provide. Okay, this is good in that case. And in case of US, very difficult to get that green card. Lot of job vacancies currently available, so jobs is not a problem in Australia, and salary is very, very high. So if you compare this salary with UK in US, even this is the highest salary I can say in Australia, and a lot of money you can save and can spend. So this is, if you see here, this is the news from AMA, Australian Medical Association. They are saying they are struggling basically to get the GPs. So there is a lot of GP shortage in Australia. I'm not talking about the specialist doctors like surgeons, or neurologists, pediatrician, or option gynae specialist, and all those things. This is just a GP. They need a lot of GPs in Australia. So after MBBS, easily you can become a GP and you can earn decent salary. So, what is the salaries in Austria for a medical doctor? So, most of people just ask me this question. So, I have basically very detailed. I did my research how the earnings in Australia. So this is how. But in general, to pass AMC Part One, the Part One exam, if you can pass, the Australia, the only country you are eligible to practice. You are eligible to work in Australia after AMC Part One. In UK, PLAB 1, you cannot work. You need to pass PLAB 2, and then you are eligible to apply jobs in UK. Same for US. You need to pass US Assembly Part 1 and Part 2, and then you have to start applying for agency. But in case if you pass Part 1 in Australia, so you are eligible to work here. Sorry. You can work as a GMO, junior medical officer or resident medical officer, and most likely the salary 80 to 120,000 per year. In average salary, you can see resident medical officer 1,000 Australian dollars, and it goes to one up to 198,000. Okay, this is a maximum. This is a minimum salaries and all those things. So this salary basically for Monday to Friday. If you are working Saturdays, you will getting paid 1.5x. So here is the salary in Australia. As you know, this is a per hour salary. So in India or Pakistan, there is no hours I can say fixed, because in my family there's so many doctors in India. So sometimes you need to work maybe 15 hours, 18 hours is very common in India. Even sometimes the PGs are working for 2 days and 3 days, they are not going back to their hostels or their homes. Okay. Or that much the work pressure in India. But in Australia, you need to work for 8 hours per day. Okay. Means 40 hours weekly you need to work, and you have a lot of time to explore Australia and to give time to your family members and all those things. So even if you are working on Sunday or public holidays, then the salary is going to be a 2x for that particular day, and on public holidays and all those things. So you can earn a lot of. I know some doctors sometimes they are trying to work on Sunday and they take week off on any other day to earn more. So the patients per day in Australia, there is a cap for you. You cannot see more than 60 patients per day. This is a maximum patient you can see 60 patients per day. But in our own country, like you can see 150, 200 in government hospitals, very common because there's the workload is very high. Doctors are not available in those areas. So here is a government funded system in Australia. Government will pay. So as a patient, if anything happened to me, or doctor advised me to visit him after one month or something, so I will always visit, because there's no need to pay any fees to the doctor. Doctor will charge the government directly. So once you see the patient, the minimum you will charge $21, or maximum you will get $250. This is also based on the conditions or the procedures you are performing. You have to charge. So and you have to work for 40 hours for 5 days only. So if you are basically seeing 40 patients per day, still you can make a very good amount. I can say 12 to 13 lakh minimum you can make per month as a GP in Australia. And there are several other advantages to migrate to Australia. For example, the education is free for kids in Australia, and healthcare access is also free for you. So if anything happened to you or your family, there is no need to worry. This healthcare access is free. And there is a very world-class education in Australia. You can see if you go with the top 100 medical colleges, even so a lot of you will find. For example, University of Sydney Medical School ranked in the world 13th rank. So that is a very good thing, if you want to be in future for your kids in education, all the things. There are top universities in Australia, education free in Australia for locals basically. And professional development, if you want to do any short course or any workshop or anything, so very easy for you to work here. the hospital, they encourage for you to do research and present in conference. They will pay all these expenses for you. Work life balance, I mentioned, you have to work only 40 hours, you have a lot of time for your family. Career opportunities, a lot of high demand, basically healthcare professionals, you will get a fast track PR visa. Quality of life is very high, obviously, and high potential of earning. These are some factors. So these are the steps you need to basically you need to take in order to migrate to Australia. So we are talking about here the standard pathway. So there is a four pathway for Australia. One is called standard pathway. Another standard pathway is called specialist pathway, and then short term training, and then competent pathway. So competent, basically you are from like US, UK, and then you can migrate here. So that is not for you. Uh, and same for specialist. If you have at least 10 years of experience after your PG degree, you are eligible to apply for that specialist pathway. And rest of the guys, if you want to register yourself, you have to go for the this um, standard pathway, and we are talking all these steps for the this standard pathway only. Okay. The first step we can say document verification. You have to do like Epic verification, then AMC portfolio, and all those things. We will help you. Our team will help you to complete this process. So no need to worry about this. Okay. And next step is the AMC Part 1 examination you need to write. Okay. So we will provide you the 4-month coaching from Australia. We provide the live sessions, plus, plus we record those sessions. If you are busy, not able to attend live session, then you will get in that case the recorded session. We'll provide you the study material, and we'll also discuss a lot of previous year question papers. And then we have a lot of mock tests, the topic wise. Okay, we also have a lot of grant tests for you. Will make your journey very easy. So within 4 months, you will be 100% confident to sit in this AMC exam to pass the exam. And AMC again after this, then you have to. I'm sorry. So after this AMC part 1, then you need to pass English test. Then you can register in Australia as a limited registration. Okay. So in that case, we will also provide you the coaching for this and the PTE or OET or IELTS. So PTE or OET is easier exam as compared to IELTS. So highly recommended go for PTE or OET. Okay. This is a step 3 process. Okay. And after this, you are eligible to work in Australia as a JMO or RMO. So the Australia, the only country allowed to you to work in Australia. Otherwise, UK does not allow. You have to part 2. Then only you can apply. Same for US as well. Okay. And simultaneously, you can prepare yourself for AMC part 2. And many doctors, they ask me this question: sir, is there any alternate for us for AMC Part 2 exam? So AMC Part 2 is nothing but it's just a OSCE exam. Same like PLAB 2 for UK. So this is a OSCE exam. And after this, you can go for AMC Part 2 or WWBA is a work-based assessment program. So there is a 4 different department. You have to work each department for 2 months, and the department helps you do your assessment. So I can say WBA program is very good. There is a 23 hospitals currently, they are WBA program. So once you pass part 1, you have to apply directly to the WBA. Okay. So there might be some questions, we are a fresher, do we, or some experience need for this. So at least if you have 6-month experience minimum, they will give you the preference. And please do not give show any loophole in your business. Don't show that you are not working. Okay, there is no, don't show any gap in between. So once you graduate the medical degree, continuously you have to work any small clinic or nursing home or hospital wherever you can. So your CV is very important when you are looking at jobs. Okay. So in that case, very easily you can get, we will guide you basically in your CV and cover letter, all those things, what kind of questions they may ask you and all those things. So this, after this, you will get the registration. Then you have to go for 1 year residency, compulsory residency. But if you are working previously, before after part one, if you are working, so they might reduce this from 1 year to maybe 6 months or something. This is from the APRA. They will see case to case based scenarios, but in general, you have to work for 1 year. After this 1 year, now you are eligible to apply PG in clinical in Australia. Okay, so PG in Australia, you are eligible to apply after this. Okay, so if you want to do in pediatrics, option gynae, surgery, or internal medicine, emergency medicine, so you have to apply in all those things here. So workplace assessment here, they are just asking, you just need to pass AMC part one and you are eligible to apply. So there are some of the jobs are available. Our team will give you the more information. So I'm not going to show you all those things. So lot of jobs currently available in Australia. Maybe I can show you one, so you can have a look basically, what are the jobs are available here in Australia. For you, once you pass this part one, what kind of jobs you can apply. So you can see once you pass this AMC part one, then now you can see junior doctor training program. You are eligible to apply, and here you can see rural junior doctor training innovation fund is there. Okay, so there is so many jobs right now is available. You can see here these are the government agencies they are hiring. So each state they have their own hiring body. For example, in UK, the NHS they hire, right? But here, the each state they have their own body and they will hire you. The Queensland, Western Australia, and here New South Wales, ACT, and all those the Victoria they are hiring here. So there's a lot of jobs is here you can hire. Even they give this email ID. So once you pass your AMC Part One in English, if you have any questions, you can directly and get in touch. So this is a government website. I am talking here the jobs in government sector, not the private. Private, you will find a lot of jobs in seek.com.au. So government jobs are available a lot. You can see here, for example, we can go anyone randomly for this one. Okay? So now you are in the Victoria, then you have to see, all those things you can apply here. So a lot of jobs are available basically in this after part one. So AMC exam, they conduct yearly 10 times in a year. If we compare this PLAB is very difficult to get a date. It might take 1 year nowadays, to get a date is very difficult for the UK PLAB. But here in Australia, that's not a problem. Anytime you are ready, you can just, book the exam and can write. So there's a 15 exam centers currently in India. In major cities, we have exam centers and they conduct this exam 10 times in a year. They need a lot of doctors, that's why they conduct a lot. So December or January, except these 2 months, they conduct in throughout the year. So in February to November, whenever you're confident, you can write this exam. And English requirement, the same for all healthcare professionals, whether you are a medical doctor, dentist, pharmacist, nurse. So we need 7 individual band in IELTS or B band in OET or B grade in OET or PT 65 overall. I mean individual, sorry. Yeah. And for part one skill assessment, need basically your degree, your transcript, work experience. If you have any work experience is not needed for this. Valid passport, government ID proof, passport photograph, medical registration if you have any. So the eligibility only you must completed your medical degree. Then you are eligible to sit in this exam. Okay. And in this exam, they will ask you around 150 questions. Okay, there's a 3-hour time. So 1 hour 50 questions. And there's no negative marking in AMC Part 1 exam. And the score in this, 0 to 500, and you need to score 250 in order to pass exam. So some questions might be for 1 mark, some might be for 2 mark, some question might be for 3 mark, and some question might be having no marking. I mean, no mark. There will be some dummy questions also will be there. Okay, that's how the system will calculate your score and they will give you whether you pass or not. But if, on an average, if you get 50%, you will pass this exam. And for PLAB, you need to score at least 60 to 64% in order to pass that PLAB, and same for USMLE. And if we compare this exam to our NEET PG in India, so this I can say this is an easier exam as compared to NEET PG, and we'll provide you the coaching for around 4 months. So easily you can crack this exam in this 4 months. So if you study 4 hours per day for 4 months, definitely you can clear this exam in your first attempt. So there is a PR visa, permanent visa. You are eligible to apply. These are the PR visa, and there is some sponsored visa also you are eligible to apply. There's some of the media coverage report academically, and yeah, fees our team will give you. We also have scholarships ongoing from academically, and we also have a loan facilities. We have a Once is our partner, so you can pay the fees in 12 months, and monthly you can pay the EMIs and without any interest rate. Okay, here are some of the reviews from students. So now I'm happy to take some of your questions from you. So one by one, please unmute yourself, can ask your doubt, or maybe you can type your question in the chat box so I can read and give the answer. And we are on the live on YouTube and other YouTube on the platform. So we can also take some questions if you are watching this on YouTube or Facebook or Instagram. Yes, Dua, Dr. Dua, can you please unmute?
Hi, good evening, sir. Good afternoon, sorry.
Here is a good evening.
Sir,
It is 9 p.m.
my yeah, okay. So my question is that what is this assessment based upon? Like, is it like very hard to pass or what?
No, as I mentioned,
Basically, my
are you Indian?
hmm. Sorry.
Are you Indian, Pakistani?
No, no, I'm Pakistani, but I live in UK now.
Okay, so
So I wanted to give PLAB, but all situation ongoing over here in UK. That's why I'm planning to just switch to Australia. But my family is forcing me to stay in UK instead of Australia. But I'm quite determined for Australia after all the pros
so I
from
can say this is,
Australia. But I'm
to pass AMC is a similar, same like PLAB. Okay, it's
okay.
not more harder than this PLAB. Similarly, I can say we have an exam called NEET PG in India. So any Indian medical graduate, if they want to do PG in India, they need to pass that exam. That exam is very tough. This AMC is little bit easier compared to that even local exam in India. So I have no idea about in Pakistan what kind of a exam, but I can say if I compare this PLAB, so similarly you can pass easily.
Okay, so basically, I have done my MBBS from Pakistan, but I'm thinking to do both PLAB and AMC. What if I pray for AMC and can I go for PLAB exams like
Yeah,
side by side? Is it possible?
no, no. Basically, the syllabus for both exams, I can say 60 to 70%. Okay, around 30-40% is the difference.
So my question is, why is there a difference? They both have medicine, so why is it different?
That there is
What's the criteria for the
it,
difference?
ethics or law. Each country have their own laws and all those things. They might each country have their own guidelines. You have to follow that. For example, the treatment of asthma. Might
Okay.
be there's a nice guidelines saying something else. Here we are saying something else. Okay, even in your own country, Pakistan, there is a dose which might be different. So each country have their own
Yeah.
own.
Yeah.
We cannot compare the same the things for in each country.
Okay.
I can
Okay.
say maximum part 70% is the same. As you mentioned, that this is a medical entrance exam.
Yeah. Okay. Thank you.
Thank you. Yes, next please unmute. Anyone else? Yes, Dr. Aftab.
Yes,
Dr.
sir.
Yes, Ronak Patel.
Yes, sir. I wanted to ask, is internship required if I have done my MBBS from foreign country?
This is depend. If you
Like,
if it is included in your medical degree, then no need. If it is
okay,
not, you are not completed in that medical school, then you have to be internship here.
okay,
Yeah. So actually, this is the main problem. Some university offering the degree like in 4.5 years, some 5 years, some 6 years. Okay. So this is depending on your medical degree. So if it is 6 years, 5.5 years, and including 1 year internship, then definitely no need.
okay, sir.
Okay.
Thank
Thank
you.
you. Yes, after Patel, after Emma, can you please unmute? Or Dr. VG, please unmute, or I can read some questions here. Yes, Dr. Mamta, yes,
Hello, doctor.
yes, hi.
Sir, I have a concern that you just explain about the visa process after we give IMC part 1 and we go through the job vacancy that we apply online. What about the visa process? Can we apply for PR visa or the
Oh,
sponsor
no,
visa? What makes them difference?
basically, if you pass part one, you are not a doctor. You just pass, you just get the partial registration, right?
Okay.
With registration. So you are not eligible to apply PR visa. So if you got a job, the hospital will give you the work visa. And you need to
Okay.
come to Australia and pass AMC Part 2 or complete WBA program and do 1 year residency. After that, you are eligible to apply PR visa. And so
Mm.
from Australia, you can come on work visa if you get a job. If not, then you can come on visit visa to ride this AMC Part 2.
Okay. Thank you so much.
Thank you. Yes, just Desai, can you please unmute?
Hello, good evening, sir. Sir,
Please.
currently I am doing my MBBS in Georgia, Tbilisi. Currently, I'm in my third year, so soon my third year will gonna complete. So, do you think that should I start my preparation for AMC exam from my third year or maybe from the fourth year only?
I mean, this is we need 4 months only. So when you are in your final stage, at least 6 months is left. At that time, you can start. I think it's too early now for you. Maybe if you want for US assembly, then you can start. So then in that case, the right time for you.
Okay, and again, sir, I have one another doubt. So, what are the study materials or maybe some books like that which we from which we prepare for the AMC Part One? Can you please suggest about that?
You can go to our website. We have a blog uh, on those things. Okay, but here at AMC, we provide a live coaching, live class. So no need to buy any book in that case. Okay, so we will cover A to Z things. But if you want to see the free book and all those things, so you can go to our website.
Okay, yeah, got it, sir. Thank you so much, sir.
Separate blog is there.
Okay, okay, sir. Thank you
Hello,
so
sir.
much.
Hello,
Hello.
hello, yes, please.
Sir, I have a couple of questions.
Yeah, sure.
My first question is AMC 1 exempted after doing USMLE 1 or both 1 and 2?
No, only can waive for you that epic verification
So EPIC verification is only exempted.
only.
And how much will the whole process take? Uh, AMC 1, 2, and registration.
I mean, this is the same journey, whether it is UK or US or Australia. So you need to pass part one and part two.
So,
It is up to you when you are going to pass. I cannot give guarantee, when you are going to pass. But I can say if you start day one, so 4 months at least for need the preparation to sit in the AMC part one. And once you pass AMC part one in English, then you have to start looking a job. So at least it may take.
and sir, I am from Pakistan and I did my graduation in 2018. So, what are the prospects for me if I immigrate to Australia?
Same. I mean, you already passed AMC, USMLE part one and part two. you already invest a lot of money and a lot of time. So same like time is the duration. I can say it may take around 8 months to 1 year, or one.
I mean to say, sir, what are the chances of getting job there once I completed the whole process? AMC
I
registration,
can say that there is a good chance if you are willing to work in the regional area.
a regional area.
Yes. So the jobs
Yes.
are available in
What,
the
sir?
regional area.
What do you mean by regional area?
So anyone is coming to Australia, so don't think that
Yeah.
you will get the job in Sydney. Sydney won't give you a job.
So
Okay.
I may get job in periphery.
Small cities is here in Sydney, in Australia. You will get job there.
Yeah. So it will be easy to find job there in the periphery.
Yes. They
Thank
need
you, sir.
doctor in the regional area. For example,
Yeah.
Sydney Medical School, 250 medical graduate from their school, and we have a lot of
Yeah.
medical schools. So these guys want to work in cities, so they need overseas qualified medical doctors in the regional areas. Okay, so if
Yeah.
you open,
And
there's
sir,
a good chance for
one
you.
one another question. Sir, will USMLE 1 and 2 be a plus point in Australia?
Why, yaar? Why? This is just a country specific exam. No advantage. If you
No
pass
advantage.
part one, can you say it in US? Can you give me some advantage because I pass AMC part one, part two? No advantage in US.
So
These are the
it
specific.
has no advantage in Australia.
No.
Mm-hmm.
Even US also will not give you any advantage if you pass AMC. So these are exams country specific. And yes,
Mm.
when you are writing the exam, that's basically easier for you. You already passed it.
And
So,
are there AMC exam centers in Pakistan?
no, we need
So
to go to other
where
country.
will I have to take this exam?
Other countries, you have to find out the nearest country to you.
In Dubai, for example.
Yeah, might be there is an exam center in Gulf countries.
Yeah. Thanks.
Yes, Dr. Hamna.
Sir, I just wanted to ask that after completing my medical degree, I would have to do internship in Pakistan, or I would be exempted from the internship and then I would do AMC.
No, you need full basically registration in your home country in your degree.
Okay.
Yeah. So in general in India, basically anyone doing medical degree, the internship is mandatory in India. Without internship, you cannot get a registration in India. So in that case, without
Uh,
internship, you cannot apply.
I'm from Pakistan.
Yeah, I mean the same thing. Pakistan is not something like a. This is called LMIC, low and middle income country.
Okay,
Because
so I have to complete my internship and then go to for AMC.
yes.
Okay, thank you, sir.
Basically, if someone is from like Russia, China, or Kazakhstan, Georgia, all those countries, so no need to write that local exam in your home country. For example, in case of India, you write FMG exam, and you can exempt that exam. Directly, you can come to Australia. But if you completed your medical degree from your home country, then you need to get the registration, then you can apply.
Okay, thank you, sir.
Thank you.
Good evening, sir.
Yes,
Hello.
Dr.
Yeah, I am a third year student in Moldova. I am a native from India. So I want to ask you that after completing AMC Part 2, how many years it takes to complete the PG, means post-graduation?
Same worldwide. Same US 4 to 6 years, same Australia, same UK. Okay?
Okay, so the subjects were for PGs, they will only allow it, or we need to select, means
No,
orthopedic
you have
or
to apply where you want to apply. When you are doing your internship, you have to choose. If you want to go for, here is a specific school is here. For example, if you want to apply for that in surgery, so you have
okay.
to apply for that school. Someone want to go to ops and gynae, so you have to apply for that school. So here is not like India. For example, if we have a NEET PG, and you need to pass that NEET PG exam, and based on your score, and they will give you the medical school or your branch. But here, not like that. You have to choose which branch you want to go, and you have to apply and follow the process.
Okay. Is it same for USMLE or it's different?
Is no. It's totally different. If you want to earn the money, if you want to work, then you have to choose Australia or UK. But if you want to go directly residency, then you can directly write this USMLE. You are right now you are in third year. You can go for USMLE if you are planning to do PG directly. In Australia and UK, you need to work after you pass AMC Part 1, Part 2, same for PLAB 1 or 2. Then you have to do 1 to 2 year residency. Then you need to apply for PG. But in case of US, directly you can apply after USMLE too.
Okay. Thank you, sir.
Thank you. So we provide coaching for USMLE and PLAB and AMC. So you can join any course, whatever is your choice. Yes. Hi, Dr. Meghna.
Hello, sir. Good evening.
Good evening.
Sir, I'm from India, but I did my graduation MBBS from Russia.
Okay.
Currently, I'm doing internship in AIMS. I passed my FMG exam. So I need Indian medical registration also from NMC before applying AMC Part 1.
In general, no need, basically, So in Russia, have you completed your internship or not?
In Russia, there is not like for every year we did practice for 2 months, not one full 1 year I completed there. Like
Okay.
every year I did my training for 2 months.
Okay.
It's
So are
about
you?
12 months, but it's not. I
So have you?
don't have any certificate
So how
from
many
there.
months since you have started your internship in India?
Currently I'm in 7th month.
7th month. Okay, so
Yeah.
you are on the right track basically. So you can start preparing, and once you completed your internship, we can immediately apply for AMC.
But after internship, I need my registration from India also.
Registration is not needed in general, but if you have registration,
Like,
basically you already passed
now I
FMG.
have provisional registration.
Okay, I mean that worked. They only need an internship 1 year.
Okay, sir. Okay,
7
thank
months
you.
already completed, and if you join us, we provide 4 months coaching. So almost, when you finish our coaching, you are going to be, finished. This time I can see you can utilize and come to Australia. This is the right time for you.
Okay, sir. Thank you.
Okay, thank you, Meghna.
Hello, sir.
Dr. Dheeraj?
Yes, sir. So you
Yes.
had mentioned after completing AMC Part 2 that we won't be directly getting any seat. That we'll have to work for some period of time, right? So
बिल्कुल से यूके में भी आपको डायरेक्टली नहीं मिलता है, ना ही ऑस्ट्रेलिया में मिलता है. हिंदी समझ में आता है धीरज?
sorry,
हिंदी समझ में आता है? हिंदी
नहीं sir.
नहीं आता है. ठीक है. तो there is a difference in US, UK and Australia. So Australia and UK, they are providing you the job after AMC Part 2 or PLAB 2. You have to work. You need to work for 1 to 2 years. In case of Australia, you need to work for 1 year. You have to work as a resident medical officer. In case of UK, you need to work for 2 years. Then in that 1 year or 2 years, you have to develop your interest in which branch you want to apply. For example, you want to apply for surgery or pediatrics, then you need
Yes,
to
sir.
apply after that only. But in case of USMLE, directly you can choose the medical school.
So can you tell the sequence of events that will have to that should happen? Like say I'm currently in my 3rd year. So when should I start, and what is the sequence of events that will happen?
You can start basically USMLE only, or for
UK and Australia.
you only can start once you complete your degree.
Okay.
They need completed their degree, then only you can start.
Okay, sure.
Okay, thank you.
Thank you, sir.
Yes, Dr. Malik, Mohtassin Hassan, can you please unmute?
Assalamu alaikum. Oh, sorry, sir.
How
I'm
are you?
from Pakistan and I'm good. How are you, sir?
Good, good. Thank you. Yes, please.
Sir, I have two queries. Number one, a person needs his hometown from where he completed his degree or wherever he completed his degree, Russia, China, or Pakistan. Is he need primary medical license of that country
No, no, no.
to apply?
If you complete it from India or Pakistan, for example, then
Yeah.
in that case you need. Okay. But in case if you
Okay.
completed from Russia, China, or XYZ countries, in that case, no need.
Yes.
Because
Okay.
in India or
And
Pakistan, you just need to complete your medical degree and that internship. Directly, you can register yourself as a doctor. There is no need to write any exam as of now in India.
oh,
Same in
okay.
Pakistan.
Okay. Okay. And second thing is after Plab 1 and Plab 2, I just read on internet and hear from different people that after Plab 1 and Plab 2,
Hmm?
AMC 1 get exempted. Is there any possibility?
No, 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 no. Once you got a registration, for example, you passed Lab 1 and 2, and you went to UK and you worked there, and you got your full
Okay.
registration after 2 years of working. Now, if you want
Okay.
to migrate to Australia, at that time it can be exempted. It is not just after the pleb they will exempt you.
Okay, and these teaching jobs, if you are teaching as a lecturer in medical colleges, or these teaching jobs are also considered your experience, or you specifically needs clinical experience?
पहली बात तो भैया एमबीबीएस वाला एमबीबीएस को कहाँ पढ़ा पाएगा, वो टीचिंग एक्सपीरियंस होता नहीं है, ठीक है. दे नीड बेसिकली स्पेशलिस्ट डिग्री टू बिकम ए टीचर, नो, और उसमें रजिस्ट्रेशन मांगते ही हैं. तो ये जो एक्सपीरियंस है, आई कैन से कैन हेल्प यू, बट नॉट आपको क्लिनिकल एक्सपीरियंस ज़्यादा चाहिए. आप हॉस्पिटल में काम करते हो, वो इम्पोर्टेंट है.
Okay, 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 okay. So, thank you.
थैंक यू.
Hello, sir.
यस डॉक्टर रोशनी.
Now I'm studying in Philippines. I'm in fourth year.
Okay.
So, shall I do my internship for applying AMC Part 1?
Yes, internship is needed in your medical school basically. If you are if you are not doing this, then you need to do in India. In case to need to pass FMG and finish and then go, because internship is mandatory. Getting internship is very difficult in Australia because local student also applying and you also applying for internship. But getting a job after AMC part 1 is easier because you are looking at job. You finish the internship things. So finish internship in your medical school. That would be good for you.
So, after fourth year, I need to do separate internship, right? In
One-
Philippines only.
Yes.
Okay, and after passing FMG,
Same. There is one girl she just discussed. She passed this FMG and she is doing internship. So once she completed internship, she can directly apply to AMC.
okay.
But getting in the pass FMG is very low. Only 10% student pass in the last exam. 90% fail in that exam in FMG in India. And even if you pass the exam, very many states are very difficult to get internship. For example, Rajasthan, many students are on a strike. They're asking to government increase the internship seats. But limited seats in India, each state they have in government schools, government hospitals. Very struggling part, those are medical degree they are doing from other countries in India.
Okay.
Better to do in Philippines and then apply.
Okay.
Or maybe you can apply, start for USMLE process, you can. Yes, Dr. Nadir Kasim, can you please unmute? Dr. Arun Jacob.
Hello, sir.
Hello, sir.
Hello. Yes, one by
Hello.
one, please. Yes, Dr. Arun.
Okay, sir. Thank you. Sir, I'm from India. I did my MBBS and I'm currently doing my post graduation in anesthesia. So should I?
Which
What is
year?
the advantage?
Are you in
Hello,
second year, third year? Which year?
I am doing my second year anesthesia.
Second year. Okay, okay.
So what should be the like if I am trying to migrate? Should is it valid over there, or should I drop this and pursue for AMC?
No, I can say, this is the right time for you. So you can prepare yourself, AMC part one, while you are in AMC part one and part two, and complete your this, almost 1 year left, right? And then,
Yeah.
and then you can migrate to Australia. Okay. So you will
Okay, sir.
definitely the job, and simultaneously very easy for you to get, again in the anesthesia. You want to do PG in Australia.
Okay, there actually I had to do a post graduation in anesthesia there.
Yes, if you want to work in anesthesiologist, again specialization if you want to work.
Okay, otherwise I can work like a medical officer.
Yes,
Just
medical
like
officer.
after an
Medical officer you can, because you already completed your medical degree. Medical officer you can work.
Okay, so in order to be an anesthetist, I had to do the post graduation again over there.
Again. So basically, many doctors they think, but once they migrate to Australia, so many of them it's up to you what you want basically in your life. For example, GP. If you want to work 5 days, 9 to 5, then GP is the best job I can say. Earning also very
Okay,
decent. You will get a lot of time to your family, this and that. You just need to work 8 hours per day. Otherwise, these
okay,
PTs and all those things you have to again in hospital and then emergency and all those things. It's up to you what you
okay.
want.
Okay, then the thing is that it's not a bad option to go for
Yes,
AMC.
many doctors basically, many doctors they think they will do PG in Australia, then they migrate here and they see the GP, then they move to GP, become a GP. So it's up
Okay,
to you. Once you migrate and think you will get a lot of time basically.
but still I have to go through the same process like everyone.
Yes.
Okay, thank you.
Basically, there is a pathway called specialist pathway. So specialist pathway in there is a two things. Theoretically, any medical graduate, PG holder, MD or MS, they did it from India, they are eligible to apply. But practically, those have at least 8 to 10 years experience. They will get only, very difficult to get that pathway. Otherwise, all you have to go in this path. Even our own lecturer, Dr. Sepalin Sharma, she is the MBBS MD from Pune Medical College. Okay. He
Yeah.
also went to the same pathway, so AMC pathway.
Okay, sir. Thank you. Thanks a lot.
Currently, she is
Hello,
working.
sir.
Yeah, Dr. Yashika.
Sir, I'm from India, but up to third year, I did my MBBS from Ukraine. After that, due to Ukraine and Russia war, I took transfer to Uzbekistan. So while applying for AMC exam, there won't be any problem in that as I took
They
transfer.
will
That's
ask
why.
your final degree is given by now Uzbekistan, right? So
Yes.
yes, so there is no problem. You have to show the medical degree basically.
Okay. And is it necessary to pass or once attempt to FMG exam before applying for AMC exam?
No, it's not mandatory, but your medical school name must be in the list. Okay, so just get in touch to our team. They will check basically, whether your medical school is eligible to sit in this AMC or not.
Okay.
Yeah.
From which the university from which I will get the degree, that university.
Yes. Final degree you are
Okay.
getting from that medical school. We need to check whether it is in the list or not.
Okay, sir. Thank you.
Okay, thank you. Please give us your phone number and email in our chat box so our team can connect to you individually. And sometimes we also have some updates so we may share with you. Yeah, Dr. Sai Kiran.
Hello, sir.
Hi.
Good afternoon.
Good afternoon. Yes, please.
Sir, I completed my graduation recently in Kyrgyzstan, 2023 June. It is necessary for me to clear the FMG and get internship in India because there is no clause like internship in the country which I did MBBS.
Yes.
I got my degree only after
In
5
that
years.
case, you need basically, they will ask the internship.
Because
Otherwise,
my documents and all my degrees, is necessary again to pass
this is
and get
how many
it.
years of medical degree?
It's 5 years.
5 years. So basically, it is need to check basically, if it is in the list, it is showing that your medical degree is 5 years. So you might need to start the process, but you need to do internship here then in Australia. Might be basically here the APRA is the body. They will see the individualized, your CV, your qualification, and then they may suggest you what you need to do. For example, you need to go for internship in Australia or no need. We
Is
can't.
there any chance to go to internship in Australia, or it may be
Yes,
any competitive process
we
than
can check
India?
for you. So you just provide us your phone number in email in the chat box. We do.
Okay, sir. Thank you.
We need to check basically. Okay.
Okay. Okay, sir. Thank you.
Okay. Thank you.
Hello.
Yes, Dr. Mayank.
Sir, actually, I have done MBBS from Kazakhstan, Almaty. After that, I passed FMG in 2020.
Okay.
Sir, then I have completed my internship also, and after that, I have done JRship for 1 year. So, but actually, sir, the final diploma they gave me, it is of Doctor of Medicine in General Medicine.
Okay.
So,
It is.
sir, can I apply for AMC?
Yes, you are eligible. Basically, what I can show you in one minute. Okay. It Let me share one thing. Right. So we need to go and need to check here. Okay. So what?
Yeah, sir, my university is there. I have already seen.
And,
It
and
is a
we need to go in
Kazakhstan.
Kazakhstan, right?
Yeah, Kazakhstan.
Okay. Which medical school is your?
Asfindiaram.
This first one?
Yeah, the first one.
Okay. Now inside they will show that medical school degree how many years here. Medical school. So your degree was 5 years, right?
Yeah.
Then you are eligible.
Sir, but
they are saying that
like
they are saying clearly here that clinical training means internship is not included in your program. So you need to complete in your home country. तो आपने ऑलरेडी एफएमजी पास कर लिया, इंटर्नशिप भी कर लिया, तो यानी यू आर एलिजिबल होना चाहिए आप.
तो सर तो इसके लिए सर क्या करना पड़ेगा अपने को?
तो वो अप्लाई, अब आपकी इंटर्नशिप खत्म हो गई है ना इंडिया में.
जी सर, एक साल की जॉब भी हो गई है सर.
हाँ, तो वही अब आप एलिजिबल हो. वही बोल रहा है, graduates must complete an internship to be guaranteed license from their country's prospective medical council. तो आपने ऑलरेडी एफएमजी पास कर लिया है और एक साल की इंटर्नशिप कर लिया है, तो आप एलिजिबल हैं. अब एलिजिबल हैं आप.
तो सर इसको अप्लाई करने के लिए सर आपकी टीम मतलब हेल्प करेगी?
यस, वी विल हेल्प टू कंप्लीट.
क्योंकि सर मैंने एक बार सर ECFMG में सर करने का ट्राई किया सर, तो उसके अंदर
अभी रिसेंटली किया था, मतलब रिसेंटली किया 1 आध महीने में या बहुत पहले किया था आपने?
नहीं, अभी रिसेंटली किया था सर. तो उसके अंदर सर वो ऐसा बोल रहे थे कि ये जो मेडिकल डिग्री है तो वो उसके लिए मतलब वो ECFMG इसको सर्टिफाई नहीं करता है.
नहीं, तो उनको आप बेसिकली ये वाला जो कॉलम है ना, तो आप उनको ईमेल पे बताओ, वो जो अटैच कर दो अपना कि मैंने उसके बाद में अपना इंडिया का एग्जाम पास किया, उसका लगा दो, शिप किया है वो भी लगा दो. पर उनको बताओ बेसिकली, तो ये प्रॉब्लम क्या है इन कंट्री में. देखो यहाँ बोल रहा है एक तो है 5 ईयर का डिग्री.
जी सर.
एक बोल रहा है यहाँ 7 ईयर का डिग्री है, 2013 के बाद से कुछ किया है, और एक बोल रहा है 6 डिग्री है. तो 3 डिग्रीज ये मेंशन कर रहा है वहां पर.
जी सर.
तो बट इस वाले केस में वो अगर आपने इंटर्नशिप और एफएमजी पास किया तो ये हो जाना चाहिए काम, बिकॉज यहाँ क्लियरली ये एडिशनल इन्फॉर्मेशन यहाँ पर दिखा रहा है.
ओके सर. ओके, तो सर मेरे को बेसिकली ECFMG के अंदर ईमेल करना चाहिए ना सर?
यस, वो जो उसमें रिप्लाई किया होगा ना आपको, तो वहां पर आप बताओ उनको कि 5 ईयर का मेडिकल डिग्री मैंने वहां से किया था, उसके बाद मैंने केम टू माय होम कंट्री यहाँ का इंडिया का एग्जाम होता है ये वाला, फॉर एग्जाम्पल FMG। उसके बाद मैंने वो एग्जाम पास कर लिया, इसका लेटर ये मैंने अटैच किया हुआ है, और उसके बाद मैंने इंटर्नशिप भी किया है इंडिया में, और उसका ये मैंने अटैचमेंट लगा, उसका लेटर अटैचमेंट करो।
ओके सर, थैंक यू सो मच।
यानी अगर आपका रजिस्ट्रेशन हो गया है, कौन से स्टेट से हो आप?
सर राजस्थान, उदयपुर।
हाँ, तो राजस्थान में अगर रजिस्ट्रेशन अगर आपका हो गया है तो वो भी अटैचमेंट लगा दो।
जी सर, है अटैच सर, दिल्ली का भी है और राजस्थान का भी है सर।
अब वो एक स्टेट का कहीं भी का भी लगा दो, आपका रजिस्ट्रेशन हो गया तो वो आप लगा दो।
जी सर, ठीक है सर, थैंक यू सो मच।
यस, डॉक्टर साकेत शर्मा।
सर आई एम एन इंटर्न इन इंडिया। तो मेरी इंटर्नशिप अप्रैल में खत्म हुई, तो मैं
इंडिया
आपसे
से
पूछना
किया
चाह रहा था कि हाँ जी
अच्छा, ओके, हाँ जी, पूछिए।
तो अभी तो मैं नीट के लिए प्रिपेयर कर रहा हूँ, बट ऑस्ट्रेलिया के लिए मेरे घर वाले फोर्स कर रहे हैं, तो एनीवेज
दिस इज राइट टाइम आई कैन, आपके 4 महीने बचे हैं इंटर्नशिप में, राइट? So this is right time basically, because we provide 4-month coaching only for this AMC. So this
but I
also,
would need my but I would need my degree, right, to get the epic registration and all everything.
yes, तो वो आपको 4 महीने बाद मिल जाएगी ना वो तो।
हाँ।
इसका जो डॉक्यूमेंटेशन प्रोसेस 2 वीक ही लगते हैं, ज्यादा टाइम नहीं लगता इसको।
ओके गॉट इट सर।
बहुत ज्यादा वो नहीं है, तो 4 महीना आप कोचिंग करो, 1 महीना अपने पास से सेल्फ प्रिपरेशन करोगे, तो ऑलमोस्ट उस टाइम पे आपका काम हो जाएगा। ये दिस इज राइट टाइम फॉर यू।
Okay sir, I'll think about it, I'll get in touch with you.
Thank you.
Okay, thank you sir.
Yes, Dr. Huma Khan.
Hello, sir. I am from Pakistan. I have completed my MBBS from Pakistan, and currently I'm doing my post graduation in my third year of total 5 years program, cardiology. So, sir, it is basically 2 years of medicine and then 3 years of cardiology. After which I'll be able to give exam and qualify as FCPS cardiologist. So I wanted to know about my prospects in Australia. With this background, I have no career gaps in between whatsoever.
Basically, as of now, you need to go to AMC pathway. But if you can complete your PG degree and you work at least for 5 years or something in your home country, then might apply for a specialist pathway. So this is the for you. And another pathway for you called short-term training pathway also is there. So if you are in your PG in your final year, you may also try for that.
Right, sir. Sir, what if I go through the standard pathway? How will this experience help me in that or not?
It will help you in getting a job easily.
So, sir, you were mentioning that the job openings are more in the peripheries, in the outback areas rather than in centers. Is this qualification or this experience will help me to get a job in cities or not?
That doesn't matter. You are overseas qualified. Your passport is very important from where you are, your degree, medical degree. So in that case, whether you are from India or Pakistan, in the same case, you need to work in the regional area. Even government gives some conditions. At least you have to work for 3 years. Then only you can come to the main cities. So getting a job is very difficult in the main cities because the local students, you have to compete with them. But in the regional areas, there is no competition. But in regional areas, not like Pakistan or India, there is no electricity or water, no school for your kids. So this is like, even in the small city, there is 5,000 population. You will get everything. There is a station will be there for a train, bus, or school होगा वहाँ पर, clean water मिलेगा, electricity 24/7, Wi-Fi fast है, मतलब जितनी भी सुविधाएं आपको कराची में मिल रही हैं, वो सारी आपको यहाँ छोटे शहर में मिलेंगी. Even better than that, no pollution here. बहुत सारे advantages हैं to migrate to small cities.
Yes sir, but I wanted to know कि जो मेरा experience time है as ये जो मैं 5 years का program है, वो मुझे towards center job में helpful है या नहीं? मेरे लिए standard pathway में उतना ही competition होगा.
It will help you to get a job.
Okay.
अगर सिटी लोकेशन में हेल्प नहीं करेगा, मतलब जो गवर्नमेंट ने रूल बना दिया है कि भाई कोई भी मेडिकल ग्रेजुएट आएगा फॉरेन से, उसको वर्क करना ही है रीजनल एरिया में, तो उसमें तो कोई नहीं कर सकते आप.
Okay, thank you.
But आपका कोई अगर है कोई main cities में, they might help you, to getting a job. In that case, it might.
Okay, okay. Thank you.
Thank you. Next, please.
Hello, sir.
Hello. Yes, Thomas.
Uh, Good afternoon, sir. This is Dr. Humayas from Pakistan.
Yes.
Sir, my question is that after passing AMC Part 1 and English language test, I will be fortunate enough to find any job in regional area. I want to know, sir, is there any time frame or time limit in which we have to appear for AMC Part 2?
There is
Or
no
is it
time limit. You can. There's a dentistry. Yes, so they have to pass within 3 years part two, ADC part two. But for AMC, there is no time frame. Okay, but you need to pass as soon as possible. Don't delay basically. Whether you need to go for AMC part two or you need to go to WBA. Then only you can get the full registration.
so? Is it mandatory to pass AMC Part 1, or we can pursue only on the basis of AMC Part 1?
No, part two is mandatory or WBA to get full registration. Otherwise, lifetime you cannot work as a JMO, junior medical officer, right?
Yeah, thank you, sir.
But if you are fail or in 3 year, 4 year, 5 year, whatever, in those times you can continuously you can work as a RMO, resident medical officer. You can earn
It,
and
me-
work.
it means we have to appear continuously.
I mean, you are asking that question only. So I'm not telling you you are going to fail for 5 times. Even they conduct yearly 4 times this exam. If you are calculate 5 times, and 20 times you fail in that exam.
That's right,
उनको फिर से कोई डाउट है कि आपने मेडिकल डिग्री की भी है या नकल नकल से डिग्री मिल गई है आपको क्योंकि 20 बार अंदर फेल करता है राइट
Yeah, right, sir.
तो 20 बार
Thank you.
में कैसे फेल मतलब 1 or 2 टाइम कैन बी
Yeah, just kidding.
टाइम अंदर फेल हो सकता है और उसका सॉल्यूशन है ऑस्ट्रेलिया द ओनली कंट्री दे आर गिविंग द ऑप्शन फॉर WBA program work based assessment program in UK this process is not available even US also not available.
So, so other than AMC, what are the other means of studying in Australia or working in Australia?
You need full registration if you want to apply any PG in Australian clinical branch. If you want to go non-clinical, for example, public health, anatomy, physiology, or pharmacology, then no need all those things.
So clinically, AMC is the only means. So what is this WBA you mentioned about, sir?
WBA means work-based assessment. They will do your assessment. You can skip part 2 exam. So in that, for example, if you are doing internship in your home country, in India, for example, it's like same thing. You have to work for 2 months for each department. For example, 2 months in obs and gynae, 2 months in pediatrics, 2 months in surgery, like this. And they have to do your assessment. And in that, the passing rate about 99%. You will pass. If something very exceptional things you did, mistake or blunder in the hospital, no one is happy with your services. In that case only you can fail. Otherwise, you will pass in WBA program.
So immediately after getting my after finishing my internship and getting my degree here in India, I can clear AMC Part 1 and go work there.
Yes.
Through WBA, I can get my registration.
Yes, they expected at least 6 months to 1 year experience after your degree. So if you are doing, continuously, you are starting this process, at least you have 6 month experience in your home country.
You mean the internship, sir?
No, this is for WBA program, the mandate. They will ask. So if you pass and you can work in Australia, they will consider that experience. Otherwise, if you have experience in your home country, they will consider that experience 6 months at least.
Okay, sir. So, like working here as a say a regional medical officer will also consider as WBA.
Any hospital, whether it is in Australia or in your home country, they will consider.
So for that, after AMC Part 1, we can directly go get our registration there.
Yes.
Is it so?
Yes, after
Actually,
part.
my college has a 1 year bond period.
Yes, so you have to you can complete that. Then obviously you will get the job.
Okay, sir.
Excuse me, sir.
Yes.
Sorry to bother you again. I just want to ask you that, as you have mentioned that at least 6 months of medical exposure in our concerned country is required to apply for a WBA.
Yeah.
Then, if it is better to do job in private sector or government sector?
Anywhere, even in a small clinic, nursing home, or if you are getting government job, कुछ भी हो, anything. You just need to show the experience.
Okay, sir. Thank you. Okay.
And to show this, please ask your employer to pay the salary in your bank account. For example, sometimes they give in the cash in hand salary in India or
Yeah.
Pakistan. So please ask them what they are paying. Whether is it 10,000 or 50,000, they just
Hmm.
need to pay your bank account.
Sir, one more question. After we crashed AMC 1, and if we have, you people guide us for part 2 as well or not?
Yes, we will provide the coaching for part 2 as well if you need.
Okay, yeah, I'm really interested because I want to give the nearby exam, so
Yeah,
that's why.
definitely. Our faculty is in Sydney. They
Okay,
are
sir. Thank you.
with these exams. Now they are working. So we are not only help you to pass the exam. After the exams, what you need to do to find a job, what kind of question they may ask you in the interview, with the skills for you, and all those things as well.
Okay, thank you so much, sir.
Thank you. Please give us your phone number, email in our chat box, so our team can connect to you after this conversation also. Please, next, please.
Assalamualaikum, sir.
Akram.
Okay, so basically my question is that is house job mandatory for applying to AMC? Like that internship we were talking about, the 6 month duration that are mandatory, but is that house job considered as your internship or that is a separate thing?
Actually, I don't know your system in Pakistan. Housemanship. All the students are asking this housemanship. So in India, what is the system? We have a 4.5 years medical school the student has to study, then plus 1 year internship in India. So total 5.5 years in India, and then after you will get a degree. So this medical graduate, Indian graduate, they are eligible to directly in the AMC exam. They will get the
Sir, in Pakistan, sorry to interrupt you. So in Pakistan, basically there is a 5 year program of MBBS, and after that 5 year, there is 1 year of a house job. So that's why I was inquiring.
Okay, so in that case, internship is mandatory. The housemanship is house job. Your is mandatory. As I just show that one of the school someone is from Russia or China. तो उसमें भी वो मैंडेटरी रहती है कि क्लिनिकल जो
So our house job experience is considered as our internship, or we have to do separate internship after the house job.
not needed. This will consider as an internship only your housemanship.
Okay, so I also basically I'm fourth year medical student, so I also have done some internships for like 1 month or 2 months during my
This is
last 4 years, and in my fifth year there is also 2 month duration.
no. This is
Basically,
need basically understand first. This is you are doing. This is called clerkship. You are doing 1 month or this
okay.
and internship means once you complete your medical school, then 1 year you need to do in at least in 4 department or 5 departments. For example,
Right.
2 months in option gynae, 2 months in the surgery, 2 months
Yeah,
in
it's pretty much the same. In our house job, we basically go in all departments for the 2 months.
yes. So we need that housemanship, that only.
Okay.
Okay, thank
So
you.
my another question was basically my husband is in Australia, so I wanted to do post graduation from the Australia. Like the main reason behind that is like my husband is there, so like my aim is not to earn money or stuff.
So your
So
husband is
basically,
a PR visa or is a student visa?
yeah, basically he has the PR visa.
Okay, very good. So basically, you just need to complete your housemanship in your Pakistan, and then come to Australia, and you just need to pass this AMC.
So for after passing AMC 1, I will be eligible for doing the post graduation there. Yeah,
No,
I
no.
also have to
They-
complete AMC 2.
Yes, AMC 2 is mandatory for any medical
Okay.
graduate. Even if you are an Australian citizen, but you did degree from India or Pakistan, still you need to do pass AMC Part 1 and Part 2 because this medical school is not approved by this AMC.
Okay.
तो
So
आपको
basically, we were planning, like after a few years, we were planning to move to some other country. So for that, AMC 2 is mandatory for completing
Yes,
the registration, right?
yes,
Okay, okay. Thank you so much.
thank you. Yes, guys, is there any another Qasim, can you please unmute? Dr. Nadir,
Hello, sir. Yes, sir. Hello.
hello. Yes, Dr. Nadir.
Good evening, sir.
Good
So
evening.
my is regarding, sir, you said after part one exam we can apply for the JMO job, the RMO job.
Yes, yes.
So will the interview be in Australia for that or
Online,
in
online. If you are in
online?
overseas, they conduct online.
Okay, sir. And then suppose if we get the interview, and then what about the visa procedures? And because I've heard that it's
Once
very
you
hard to
got,
get visa for the
yeah.
Australian.
So if they hire you, then they may
Yes,
give
sir.
you the visa on work visa.
The hospital will be sponsoring us.
Yes, work visa. Yes,
Okay, and the all the interviews will be online, or do I have to come there?
online.
Okay, sir. Okay, sir. Thank you, sir.
Okay, thank you. Yes, please, next. Dr. Prathamesh.
हेलो सर
Hello.
मैं सिक्स ईयर मेडिकल स्टूडेंट हूँ टिब्लिसी जॉर्जिया में
Okay.
तो मेरा क्वेश्चन ये है कि मेरे को इधर कंप्लीट करके सिक्स ईयर इंडिया में इंटर्नशिप करके ऑस्ट्रेलिया में अप्लाई करना चाहिए या मतलब यहाँ से डायरेक्ट में अप्लाई
इधर जॉर्जिया में इंटर्नशिप होता है नहीं होता आपके मेडिकल स्कूल में?
सिक्स ईयर करिकुलम है हमारा लेकिन ऐसा सेपरेटली 1 ईयर इंटर्नशिप नहीं है इधर मतलब जैसे आप बोले क्लर्कशिप बोल सकते हैं वैसा होता है हमारा 2 मंथ्स 3 मंथ्स पोस्टिंग्स होता है
No, no.
हॉस्पिटल में पूरे
No, no.
करिकुलम में
बात समझो अगर ऐसे अगर वो 2 मंथ फॉर एग्जांपल 2 मंथ इन सर्जरी और 2 मंथ इंटरनल मेडिसिन और 2 मंथ इट्स लाइक 5 डिपार्टमेंट में ऐसा अगर 5 2 मंथ अगर है तो वो एप्लीकेबल होगा पर अगर वो नहीं है तो फिर आपको इंडिया में आके जाना पड़ेगा तो ऐसा क्या है स्कूल आपके स्कूल में क्या है वो है बेसिकली
लेकिन वो कंटिन्यूअसली नहीं होता जैसे हमारा 4th ईयर में सर्जरी होता है और
ओके
2 मंथ का होता है
तो फिर तो इज लाइक सेम इन इंडिया जैसे कि वो नो मतलब फिर तो आपको इंटर्नशिप करनी पड़ेगी तो इंडिया में क्या होता है 3rd ईयर 2nd ईयर से बेसिकली बच्चे मेडिकल स्कूल में जाते हैं राइट और फिर वीकली होती है रोटेशन काइंड ऑफ थिंग
हाँ हाँ
तो इन दैट केस आपको ये करना पड़ता है बट यूएसए में यू कैन स्टार्ट
अच्छा मतलब इंटर्नशिप करना पड़ेगा इंडिया जाके एएमसी के लिए और
Yes.
उसके बाद एएमसी अप्लाई कर सकते
यस या फिर अगर वो आपके अगर मेडिकल स्कूल में करवाएं एट द एंड तो फिर नहीं करना पड़ेगा
अच्छा क्योंकि इसका करिकुलम ही 6 ईयर का है पूरा मतलब 6 ईयर तक पूरे सब्जेक्ट है हमारे जैसे लास्ट तक फर्स्ट टू 6th ईयर ऐसा
तो आप अभी
थैंक यू सर
6th ईयर में हो
6th ईयर में अभी
ठीक है तो आप क्या करो अपना हमारी मेडिकल हमारी टीम से कांटेक्ट करो अपने कॉलेज का नाम बताओ कौन से तो लेट वी कैन चेक दिस
कॉलेज वो ECFMG WFME पोर्टल है ना उसमें रजिस्टर है हमारा कॉलेज मतलब यूएसएमली प्लेटफॉर्म
यस तो उस कॉलेज में क्या लिखा हुआ है क्या वो 6 ईयर का प्रोग्राम है आपका और उसमें इंटर्नशिप के बारे में उसमें क्या लिखा है वहाँ पर कुछ इसमें ऐसा कुछ कमेंट
इंटर्नशिप के बारे में तो कुछ लिखा नहीं लेकिन ऐसा लिखा हुआ है उधर की 6 ईयर करिकुलम है हमारा ऐसा
okay then I think in that case you can complete basically and it might be you need to do in Australia maybe
तो उसके बाद मैं एएमसी के लिए अप्लाई कर सकता हूँ और एग्जाम देने के बाद फिर एएमसी 1 के बाद जॉब मिलता है ना ऑस्ट्रेलिया में
यस मतलब एलिजिबल हो आप जॉब मिलने के लिए अब प्रॉब्लम ही आपका ये है कि आपने क्लिनिकल एक्सपीरियंस कुछ है नहीं, आपके पास जीरो है बेसिकली, बिकॉज
Yeah,
यू नॉट कंप्लीटेड योर इंटर्नशिप
yes, okay.
ना। तो ये है आपको, बट आपको यूएसएमएलई इन दैट केस यूएसएमएलई इज द बेस्ट सॉल्यूशन।
Okay, sir. Thank
आप
you.
यूएसएमएलई में चले जाओ, उसमें जरूरत ही नहीं है उसका।
Okay, sir. Thank you.
यस नेक्स्ट विजी। यस डॉक्टर।
Yes, doctor. Actually, I'm senior medical practitioner. I'm specialist in pathology, and my age is around 49 year at the moment. So, how this high more age will can affect for getting job as a RMO or
ऑस्ट्रेलिया में जो वीजा होता है, आई मीन टू अप्लाई वीजा, स्पेशली द वर्क वीजा, सॉरी द पीआर वीजा, परमानेंट वीजा, योर एज बिलो must be below 45 years of age. But
yeah, okay.
to apply for work visa, there is no age limit. So you can apply for, you can come Australia on work visa, you can work for few years and maybe, go back. But you cannot be a citizen in Australia. Your age must be below 45 years of age.
Okay. Then what others you suggest that USMLE is better at the moment at this
I mean,
age?
at age, I 49, already, and it's very difficult basically, and because there's a lot of young doctors, they are applying for this thing.
Okay. Even
Yeah.
for UK?
Same. I mean, age is the main concern. But UK, you are eligible. UK में तो, I mean, you have to work for 3 years, then you need to apply. But UK, you can USM that lab.
Okay. Thank you.
Okay, thank you. Okay, guys. Any else, or we can finish here? Last take the question, please, or otherwise we can finish here.
Does processing?
I don't know. Is there any few questions from Tawsif? There's a few questions from YouTube or somewhere, or social media?
Sir, checking, sir.
Yes, please. Please, those who are watching us on YouTube, please comment. So I will try to reply to you now. Yes, please.
So quickly, sir, I wanted to ask, what are the percentages of passing AMC 1 and 2 along with PLAB 1 and 2?
I mean, you are trying to be in two different countries. So there is no advantage or disadvantage. I can say same like कि अगर आप PLAB में और USM में, तो I think for PLAB or AMC. So both the exams is like similar things, but I can say the job opportunity can be more in Australia as compared to UK. Nowadays, a lot of news about the saturation.
But I heard that passing ratios are more in PLAB as compared to AMC.
Dekho, we providing coaching for PLAB also, so you can go PLAB. So this is not something I'm trying to convince you to buy this our course. We provide USMLE, we're providing PLAB, we're providing AMC as well. Okay, so I can say that PLAB 1 and AMC 1 is a similar passing rate, around 60 to 70%. But part 2 little bit AMC, part 2 little bit tough, but you can go for WBA program in Australia. In case of UK, that you need to go to UK to write this PLAB 2. But in Australia, even you can write this PLAB, this AMC part 2 from home country also nowadays. These are the few things, so you have to decide where you want to go. We can help you to pass PLAB, even same for AMC.
Right. Thank you so much.
Thank you.
Hello, sir.
Yes, Dr. Milen.
यस सर, सो हम अगर यूएसएमएलई और एएमसी का कंपैरिजन करें, तो अगर हम यूएसएमएलई के लिए जाए तो वहाँ पे कैसा है कि सर्जिकल ब्रांच में आईएमजी को मैच करने के लिए बहुत डिफिकल्टी होती है, तो एएमसी में कैसा है, मतलब इज इट इजी फॉर अस?
No. First of all, easy कुछ नहीं होता यहाँ पर. Again, you need to compete with local student as well, because in PG local भी apply करते जो आप भी apply करते, and so if you are not getting in first year, you will get in second year. Basically यहाँ पर क्या है, आप job कर रहे होगे उस time पर, you are working and you are earning. So if you are not getting in first year, you might get in second next year. you will have 1 more year work experience. But in case of USMLE, you have to be in your home country and apply again.
ओके सर, मतलब पॉसिबल है. आई डिडंट मीन इजी है, बट पॉसिबल है, राइट?
पॉसिबल है. बहुत सारे जो डॉक्टर्स हैं यहाँ पर वो इंडियंस हैं, और पॉसिबल तो है. इट माइट टेक नॉट इन फर्स्ट ईयर, माइट बी इन सेकंड ईयर, मिल जाएगा आपको. मगर पॉसिबल तो ऐसे इट्स नॉट लाइक इम्पॉसिबल है. बहुत सारे इंडियन डॉक्टर्स हैं सर्जरी के अंदर यहाँ पर.
ओके सर, थैंक यू सो मच.
थैंक यू. यस, किसी का कोई और क्वेश्चन है, और वी कैन फिनिश हियर. Yes, Dr. Firoz.
Yeah. Hello.
Yes, Dr. Firoz.
Sir, you were telling about the WBA program. If we have experience in India, we can. Hello.
If you have experience in India, for example, 1 year, 2 year, 3 year, whatever, this will help you to get to the WBA program.
So WBA program will be done in Australia, right?
Yes.
So during that time, WBA program, will we get any stipend or any salary or something?
You have to pay the fees to the government for that, WBA program, and you have to because this is a very flexible thing. You will get paid also, and you also need to pay the fees also.
Okay, we'll be getting the payment, and we'll have to pay for that thing, right?
Yes. For example, if you are doing in PG in AMC Delhi, there might be some fees for that. Might be 10,000, 20,000, whatever. But you also simultaneously you are getting paid also.
Okay, so if we clear the WBA program, then we don't need to clear the AMC too, right?
Yes.
Okay. So
WBA
actually,
program only conducted in 23 hospitals. Okay.
okay.
Yes. So this is the limitation. You only can do in these 23 selected hospitals.
So how easy did you get it? Is it difficult to get in, or it's very?
Definitely difficult. There's nothing is easy. Even in India itself, it's not easy to get a PG seat. You are an Indian citizen. So
Okay.
Easy in Australia, but this is not impossible. These 23 hospitals only for IMGs only. So you are with other IMGs. For example, someone is from Pakistan, Bangladesh, and you are applying. Someone might be from Malaysia. So you are these are only for IMGs. So you are competing with other IMGs only.
Okay.
These are not for the local graduates.
Okay. So my question is, if we come to Australia after clearing AMC 1, and we are waiting for the WBA program, so my question is, in that time we are not eligible to work or do nothing, right? So we'll have to.
You are eligible. After part 1, you are eligible to work in Australia. So Australia is the only country in the world they are allowed to work after part 1.
Okay, we can work. So
Yes,
so you're
you
saying that it's easy to get job after AMC 1, not easy or what?
No.
Is in regional areas, you said that actually we can find jobs.
Yes, so you are eligible to apply jobs after part 1. And if you are ready to work in regional area, there's a good chance, I can say.
So we can work as a general practitioner after AMC 1.
You cannot. You're not a practitioner. You just a assistant kind of things.
No, if we have experience in India, can we work as a general practitioner?
No. You are not a full license. If something
Okay.
in Australia, you are not a full licensed doctor in Australia. Someone is how you're basically you are not. You only can practice in Australia after the AMC Part 2 or WBA. But
okay,
you have to work under the supervision of a RMP in Australia after AMC Part 1. For example, you are doing internship in India.
Yeah.
Work under the supervision of any PG or any lecturer in India, right? So same
yes,
is here. Is applicable to you. कि आपको 10 साल experience in India में doesn't matter. But Australia आपको work करना है after part 1. You will get a job, but you will there is a 3 level basically, or level 1 to 3. So there is each level have their own advantage. Like supervision, you might need a very limited, like a very minimum supervision you need.
Mm-hmm.
Yeah. So you need supervision basically after part 1.
Okay, so after part 1, can we do this assistant job in any hospital?
Yes.
Or do we have to?
Hospital.
Is it possible?
Yes.
Okay. So my
junior medical officer.
Okay, and my question is the during that program, the money which we are getting during that time, is it enough to be in Australia, or do we have to take money from home to?
In the enough, अगर तुम जो जितने इंडिया में तुम अर्न कर रहे हो राइट नाउ, उससे ज्यादा you can send back to your home country आफ्टर रहने खाने के बाद यहाँ पर वाइफ हस्बैंड एक दो बच्चों के साथ में. I mean even 5 lakh.
सर मैं अभी इंडिया में काम नहीं कर रहा, एक्चुअली मैं क्रूज शिप में काम कर रहा हूँ, सो द सैलरी इज वेरी गुड इन क्रूज शिप.
Then you can be there. In India में जो भी मेडिकल होता है, अपोलो हॉस्पिटल 50,000 रुपए पे करता है.
जी 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 जी, मैं BLK में काम किया था एक्चुअली 1 साल.
तो कितने पैसे मिलते थे आपको? इवन जो
1 लाख मिलते थे उस टाइम.
इवन जो NRHM है ना इंडिया के अंदर, कितने रुपए पे करती है MBBS डॉक्टर के लिए? They are paying 50,000 only, 56,000 only. मैं उसको कंपैरिजन में बता रहा हूँ, आपको इतने आप सेव करो, उससे ज्यादा आप सेव करोगे.
Okay, so even during assistant job we can save some money, right?
Yes, saving is up to you basically, you know. अगर आपको कोई 5 लाख रुपए दे रहा है, 5 लाख रुपए आपने खर्च कर दिए कि आपको भाई BMW गाड़ी भी चाहिए, आपको 5 स्टार होटल में चाहिए, इधर उधर पार्टी करनी है, तो कहाँ से
नहीं सर, एक्चुअली मैं ये
एक नॉर्मल जो चीजें होती है ना, अगर आप वो करते हो डेफिनेटली यू कैन सेव.
ओके, समझ गया. जी, मैं आके माइग्रेट करना चाह रहा हूँ. मैं अभी क्रूज शिप में काम कर रहा हूँ, तो आई थिंक आई हैव टू.
I came to Australia, मुझे मिलते थे $27,000 per year. Me and my wife are living in working, basically हम लोग रहते हैं सिडनी के अंदर, तो वो एनफ पैसे थे हमारे लिए. 27,000 पर ईयर आपको मिल रहे हैं 100,000. नाउ यू कैन कैलकुलेट कि आप कितने सेव कर सकते हो.
ओके,
आपके हाथ में कि आपको कैसी जगह पर रहना है, क्या करना है. नो, यहाँ पर भी एक्सपेंसिव जगह होती है, बहुत रीजनेबल जगह भी है यहाँ पर रहने के लिए.
ओके, सो वो PR मिलने के लिए कितना साल रहना है उधर? सो AMC 2 क्लियर करने के बाद
ऐसा कोई कंडीशन नहीं है यहाँ रहने के लिए. ओनली द कंडीशन यू नीड टू पास AMC Part 2 और WBA, and then 1 year you have to do residency, then you can apply.
Okay. Okay, thank you sir. So
you can need 3 years, you need to work, then only you can apply the PR in UK, but in Australia there is no such condition.
सर एक्चुअली मेरा एक और क्वेश्चन था, ये कोचिंग जो आप कंडक्ट कर रहे हो ऑनलाइन, इसे लाइव क्लासेस है या प्री रिकॉर्डेड क्लासेस है?
लाइव क्लासेस है. If you miss any live class, then you can in that case you will get the recorded one.
Okay, recorded class भी है.
वो मतलब अगर आपने मिस किया तब हम तो लाइव कराते, हमारे सारे लेक्चर्स लाइव रहेंगे, मगर हम उनको रिकॉर्ड भी करते हैं. तो इफ यू समवन इज मिस, फॉर एग्जांपल यू आर इन हॉस्पिटल, तो इन दैट केस यू कैन गो बैक एंड चेक द रिकॉर्डिंग सेशन.
नहीं सर, मेरा केस एक्चुअली मैं बोल रहा था, मैं क्रूज शिप में काम कर रहा हूँ, सो एक्चुअली sometimes I cannot attend that regular class. Is there any option for offline?
इसलिए तो हम बोल रहे हैं, हमारे जितने बच्चे होते हैं डॉक्टर्स, they are very busy, everyone is busy. So hardly 40% they attend live class and 60% they see the recorded session. So no, not all. Basically, for example, recording 5 lectures in a week, so try to attend at least 2 or 3 you can, whatever rest you can see. You know.
Okay, समझ गया. Okay, thank you sir.
Thank you. Hello guys, any other question or we? I don't know. Yes, some questions from social media.
Hello sir.
Yes, hi.
Sir, myself an orthopedician. If I finished from India, so I'm trying to migrate to Australia. So how is the process after AMC clearance? Do there any condition that you have to work for these many years as a GP before getting into surgical training program or something?
No, there is no such condition. But you know, you need to show basically, you know, why you want to go in surgery. So in case your case is very straightforward, you already did your degree, so for you it's very easily you can get basically. For example, basically someone is a fresh MBBS.
Okay.
Now you need to prove why he want to go in surgery. So surgery, you know, but आपको definitely मिल जाता.
Okay. So after clearing the AMC, this surgical training program, how many years will it take to finish that kind of thing?
At least 4 years. But if you want to go like super specialty, it might take 6 years.
Okay, so minimum 4 years you have to get training from the specialty hospitals.
Yes.
Okay. So in between, in that there will be exams and all. Only after that you will get recognized as a specialist, right?
I mean, it's like, the general things like, Viva thing kind of things, general exams in the hospital.
Okay.
Like assessment, this and that.
Okay. Thank you.
Okay, thank you so much.
Dr. Nadir was raising his hands. Dr. Nadir Qasim.
Ali, I think we already given to him. Can you please, do you have any other question, Nadir? ये हाथ उनका पहले से ही उठा हुआ है तो
Hello, sir.
Yes.
Hello, sir.
Yes. Please ask your question.
Sir, yes, sir. So, you said we need our IELTS band more than 7 for applying for part 1 exam, right?
Not part 1. You need after exam, after AMC.
For applying the JMO job?
Yes. When you are applying UK, you need English first. But in case of Australia, you can give English after AMC.
Oh, sir. Previously, I was having a misconception, and I think I already wrote my IELTS last year, and then it has only 2 years validity, and I'll only be able to write AMC part 1, I think, this coming December.
For AMC, English is not needed. It is needed when you are applying for your registration.
Okay.
So at that time they need.
Okay, so for part 1 right now, we don't need one.
No need for AMC.
And then, so you're saying after if we passed AMC part 1, and then when we apply for the job position, before that we need to complete it. Yes.
Not job. Once you pass, then you have to apply for your registration, limited registration, right? And
okay.
To APRA. In that case, you need English. And once you got the registration done, then you have to apply in jobs.
Oh, the JMO post.
Yes, JMO or RMO.
Okay, that registration will take how long?
No, it takes hardly 1 month.
Okay. Thank you, sir.
But in general, when you pass, you can just start looking at jobs. The hospital people, they know. International guys, he can apply in all this thing.
No, but I need to get my registration and IELTS exam, right?
Yes, IELTS is definitely a need after AMC.
Okay, and then I have to apply for the registration, and then after getting the registration, I need to apply for the post.
Yes, post I am saying you can apply before applying registration as well. Because for example, if you applied today, after 2 weeks they might ask you to give interview. So it takes time.
Oh, okay.
Once you pass AMC, you got result, you just start looking a job, and simultaneously you apply for this as well. Or if you English and then
for registration, then I don't have one.
Hello,
yes, sir.
Yes.
No, but then it will take time, right, for the registration? You said it will take 1 month.
1 महीने लगेगा. 4 week only need. तो 4 week तो तुम जॉब अप्लाई करो तो तुम्हें 4 week नहीं चाहिए होंगे. अगर आप 10 जगह अप्लाई करोगे तो शायद 10. If you apply in 10 jobs, might be 1 will consider your application, and then they invite to interview. It might take one month.
Oh,
so,
okay, sir. Okay.
Once you pass this AMC, you start looking at jobs. Simultaneously apply for a registration.
Okay, sir.
Okay, thank you. Please give phone number, email in the chat box so we can connect.
Just one question from social media, I think, which you have already explained, but if you can just explain it once more. This is for people who have done their MBBS from different other countries, and they are concerned about clearing FMG. right? I mean, if you can just explain that process, they can go ahead.
Yeah,
and as
basically,
well.
FMG, the clearing is not mandatory. The only thing, if you completed your internship from that country, then no need to pass FMG. Without FMG, also you can apply Australia. So Australia only that AMC just required to see your final medical degree, and that medical degree school name must be in the list. That's it. These are the requirements. Okay, and then we can finish here. It's too
Okay,
long.
so thank you for your time. Thank you everyone for your presence.
Everyone. Okay, bye.
Thank you.